Namaskar viewers. Bone or the skeleton is a vital organ to hold our body erect and successfully conduct every activity. To know about the exact working or a correct working of the skeleton, and if at all there are some things which are not in order or needs medical treatment, what is it and what wrong can go with our bones? That is any kind of a cancerous situation. So we have Dr. Abhijit Salunke with us, who is a consultant orthopedic oncosurgeon from Gujarat Cancer and Research Institute, Civil Hospital, Ahmedabad. So let me welcome Dr. Abhijit to Health Question Program of Dines Media. Namaste, Doctor.
Yes, so orthopedic oncology or bone tumor surgery is a branch which deals with patients having bone tumors. So there are two types of bone tumors. One, we can say it is a primary bone tumor, means occurring in the bone primary. So it can be of two types. One is benign, second is malignant. Benign means it is a non-cancerous tumor. Malignant means it's a cancerous tumor. And second, more common type is metastatic type. Metastatic means the tumor is somewhere in the body. For example, it can be in the lungs, or it can be in the intestine, or it can be in the thyroid or any other body part, and it has spread to bones. So that is called metastatic bone tumor. So that is more common as compared to primary bone tumors. So just I'll share a PPT so that we can get more idea. I'm working in Gujarat Cancer Research Institute. It is situated in Ahmedabad, and this is my hospital where I work. So it's a government cancer hospital. It's one of the biggest cancer hospital across the globe. So it's very big hospital. And it's a government cancer hospital. So all treatment is done free for all the patients. So patient comes here across the country, and international patients come to us. We try to help them all. So this is a place where I work, and all work has been performed at our center. Whatever slides, videos are there. So to know what is bone tumors, we should know that it's very rare. It's not a common type of tumor. So head and neck tumors are very common tumor. Breast tumors are common. Female genital tract tumors are common. GI tumors are common. Bone tumors are very less. So its incidence is less than 1%. So if there are 100 cancer patients, there will be only one bone tumor patient. So it is that uncommon. So this is the incidence that in 1 lakh population, you will see one patient. So Indian population is around 130 crores. So you can calculate 1% will be having these type of tumors if they get a tumor. So it's a rare type of tumor. That is one for sure. So the people who are operating these tumors are also very less across the country because the incidence is less. So this is an X-ray of a patient where we can see some tumor involving the shoulder here. And what investigations are done, we'll see subsequent in our talk. So primarily we should know that these are very rare tumors, uncommon tumors, two common type. One is primary bone tumor, that is involving primarily the bone, and second is secondary or metastatic bone tumor, means tumor somewhere in the body which has spread to the bone. So that is secondary or metastatic. That is more common.
So, doctor, as I said in the beginning, that as a layman,
Yes.
all we know is there is a pain, there is a discomfort, and I'm unable to do some sort of activities which were normal to me before. Now, what I want to understand is what are the symptoms that can be identified as a bone cancer?
Yes, so we'll go to our next slide and the clinical presentation. So a patient with swelling over his arm region, and here we can appreciate there is a swelling. The skin looks bit tense, shiny, few dilated veins, and the patient is, if the tumor is near the joint, he will have limitation of movements. Means if it is in the knee joint or femur or leg, the patient will be unable to bear weight. So that is the symptom. So any patient with swelling over his extremities, upper limb or lower limb, swelling, pain, which is for long duration, not relieved by any painkillers, and limitation of activities. So these are most common symptoms. Then pathological fracture, our fourth point. Pathological fracture means the fracture has happened due to tumor. That is called pathological fracture. So that is one presenting symptom. This can occur. So these are presenting symptoms. There is a pain, there is swelling, which is of short duration, then it's malignant. Means the history is of 2-3 months, very fast growing tumor. Then it's a malignant tumor, most probably. If it's slow growing tumor, history of 1 year, 2 year, 3 year, then most probably a benign bone tumor. So this is the presenting symptom how the patient presents to us.
Okay. Sir, if as an individual, I'm not from medicine background, but as an individual,
Yes.
if I happen to say that, okay, this looks like a bone tumor to me, is this what I will see in somebody?
Yes, so this is what the patient goes to orthopedic surgeon. So always the patient goes to orthopedic surgeon or a physician.
Right.
The patient, this patient doesn't come directly to us.
Right.
So he goes to an orthopedic surgeon or a physician. He clinically examines him. He sees that something wrong is there. And then they refer the patient to us as a suspecting something. They get a X-ray done. So we'll see how we read a X-ray. That also we'll see.
Please.
So this is a case. So these are the symptoms. Yeah. So you have seen the patient. It's pain, swelling, limitation of movement, pathological fracture. Systematic symptoms means weight loss. The patient is having some weight loss. Okay. Then we examine the patient. So this is a small video how we examine a patient. So here we can appreciate there is swelling over the shoulder region here. Correct. A 14 years boy with a swelling over the shoulder. Some swelling is there. So this patient first presented to an orthopedic surgeon. He got an X-ray done for him. So this was an X-ray and he got an MRI done. And then they referred the patient to a cancer surgeon. So this is a small video. So this is a child. So here we can see there is some swelling over the left shoulder region. Yes. So the skin is bit tense, shiny. We are first checking the temperature. Then we are checking any pain on touching it. It's a mobile swelling. It's moving. Yes. Fixed to the bone. Yes. Then we'll check the shoulder movement. So he's able to do his shoulder movement here. So here we are examining. Right. Then next we check, mark the all locations where it is. Then we check the pulsation. So this is the movement. He is able to do shoulder movement, but it is slight limitation of shoulder movement. It's not complete. Then we check the lymph nodes. We check the pulsations and other movement. And this was the X-ray and MRI of the patient. So these are the investigations what should be done for these patients. So you check patient clinically and then get them investigated. Sir, क्या stages होते हैं for the surgeon? Yes, so we'll go to the stages also. So next is we see the X-ray of the patient. So after X-ray, you get an MRI done. So for any tumor, you require an X-ray, you require an MRI, you require biopsy. So after biopsy, you get a staging workup done. So staging workup means you want to check whether the tumor has spread to any other body parts. So the bone tumors can spread commonly to the lungs. So you get a CT scan done or a PET scan done for these patients. So these are the tests what we do for these patients. So what is meaning of biopsy? Biopsy means you put a needle inside the bone, remove a tissue in some part of the tumor, send it to your pathology friend. They will tell it's a tumor or a non-tumor. So after biopsy, you require staging investigation. So these are the staging investigations. So you require a MRI, you require a CT scan and a bone scan. So you commonly hear word PET scan nowadays. PET scan. So PET scan is used for staging workup. Means the tumor has spread to any body part or not. That can be told by a PET scan. So it can be stage 1 or a tumor with later stage. In the later stage, tumor has spread to the body part, other body parts. So in that cases, your survival becomes bad. Means chances of patient living further with your treatment is bit bad. And for our tumors, you require chemotherapy in majority of cases. So these tumors are seen in pediatric patient more commonly, young patient. And osteosarcoma and Ewing sarcoma are two common tumor types where you require chemotherapy. So chemotherapy means the drugs which will kill the tumor cells. Absolutely. So in majority of cases, you require that. And after that, you require surgery. Okay. Day 1 or day 2, just you can make him stand. If it's lower limb surgery, you can allow him to stand with a walker. If it's upper limb, you can give a elbow pouch. he can go back. School and other activities or other activities take time because it's again chemotherapy. After surgery, you require chemotherapy. So it's a 1 year treatment plan totally, nearly 1 year. So you need to keep them motivated for long time, very long time. So that is very important. Or they will leave the treatment in between and then the outcomes are very bad for them.
And very crucial also because
Yeah, so it's life and death for them that if he defaults anywhere, the tumor will spread to the body parts and survival becomes very poor for them.
okay. So, doctor, what is the treatment course? That is something called Ewing sarcoma and other things that you have.
Yes, so Ewing sarcoma is a tumor involves the bone, and osteosarcoma again tumor involving the bone. These occurs in pediatric patients. So we'll see few examples. The patient which we have done surgery and doing good. So 4 or 5 small videos are there. 1 minute, 2 minute videos. So I'll explain them to you. So we have replaced the thigh bone for this patient, and this is a small video. What is? So total femur means whole of the femur is replaced. Hip joint, knee joint. So this is a simple animation. So thigh bone means the knee bone above the knee joint.
Okay, replace in the sense what is the material used?
We have put a joint here. So here we can see an X-ray of this patient. So this is the X-ray after chemotherapy of this patient.
Okay.
On the left side, we can appreciate something wrong. Right side, it is normal. Left side, something which I have marked in red. That is a tumor area. This is after chemotherapy. So we want to remove all this bone and we'll put a metal joint here. So whole of this bone will be replaced. So this is the artificial joint what we put. So here we can appreciate something over the hip and knee. So this is the joint replacement surgery for tumors. So here replace whole of the bone.
It's the same for the fractured one also.
No, for fractures they do smaller joints. This is very big joint. Whole bone is replaced.
Okay.
For normal knee replacement, it's very small knee. Your whole bone you are replaced here. So you need to cut whole of the bone, remove the tumor, save his artery, vein and nerve, and then we put this for this patient. And this is the patient. We'll see the X-ray of this patient. So this is the X-ray. Here we can appreciate. So this is the normal bone. You have replaced the hip joint, you have replaced the knee joint. So this was a scar, a young girl. So around 4 to 5 years follow-up of her. Yeah, this was a scar. So whole femur you need to remove. And this is a function. Her ankle movement is good. She is having limp and lurch. You remove all the muscles. So patient has some limp and lurch. It can't be normal. 100% it can't be normal. Patient will have some defect. Bit lurch and limp is there. We'll here replace whole bone. But patient is able to go back to all our activities. Good hip abduction. All activities are possible. So these are the special joints what we use for these patients. So whole bone can be replaced. So this is one example. This was osteosarcoma. This is one case. Next is you put a special joint. This is a growing joint. This is used in pediatric patient. Means a small kid is there, less than 11, 12 years, that this joint will grow. This is the joint put, and it is a true mechanism. So every time small incision, you can turn few threads and the leg will grow by 1 centimeter. So this is how it is expanded. You can appreciate this part is growing here. You are turning few threads and this part is growing. It's an expandable or growing joint, what we say. So this was the tumor of the patient. We removed the tumor and this is the X-ray of the patient. So it's a growing joint. So these are two treatment options what we use when we want to save our patient's leg. You can put patient's own bone also in the body. You radiate it or liquid nitrogen it and put it back again at its original site. That can be also option. That can also be the option.
Doctor, I am again and again very curious to know what kind of people would face this problem.
So
as you said, it is very rare.
These tumors, It is rare, and a patient comes referred by someone else to our hospital. So we see these commonly. For an orthopedic surgeon, this is a rare thing, but for this is day in day out for us. So our OPDs of around 80 to 100 patients. Every week we see around 150 patients of these type of tumors. So for us it is common, but for orthopedic surgeon it's rare type. And two treatment options. One is this, what we save the limb of the patient. Second is in few cases you can't save the leg or hand. That is also yes. So we'll see an example that what is life without hand of our patients. So your hand is not there, still they are back to their work. So this is a motivational thing that oh, yeah, this is the patient. He is having yes. Yeah. So he's attaching his upper limb. Yes, amputation of hand was done. So in all cases, you can't save the limb, upper limb or lower limb. So few cases you need to cut it to save the life of the patient. So in these cases, tumor was not possible to save his limb. It was involving the. You can appreciate here. He's opening his fingers. So it's a special electrical hand, what we had made for him, based on yes.
So that also you have manufactured in your.
No, this is not manufactured by me. We are trying to develop a low cost of this, but this is not our own. So we have taken help of a few engineers here. This is their joint developed by them. We are trying to make a low cost this type of processes, but it will take at least 1 to 2 years finally. So he is able to pick the object.
Do all kind of activity.
Yes, and he is able to drive his car also. So this is example where you don't have a upper limb. Second, I will show example where you don't have your lower limb. Again, patient is back to his activity. So this is a patient where your ankle joint works as a knee joint. So you cut the tumor. So you can see his leg is turned by 180 degree. And ankle joint is working as a knee joint. This ankle joint is working as a new knee joint for him.
Okay.
So this is called a rotation plasty. So a rare type of surgery. So you can appreciate here the ankle joint is rotated. So normally our ankle is in front.
Right.
His ankle is rotated by 180 degrees.
That's scary.
But it's not cosmetically great, but it's excellent for the patient.
No, but as you rightly said, the life is saved.
Life is saved, limb is saved, and he's back to his work. That is the purpose of all things. We are doing some special things, that is 3D printing. So we means print the part and put it in the patient. So again, that is done at our center. Very few centers across the world are doing this.
That is really great.
So you print the bone of this patient, and you can print this specific part and put here. So example is in the next case I will show you. We have printed the ankle bone of the patient. So here you can appreciate this bone here. Yeah, this is the 3D printed bone. According to the size of the patient, we have printed the bone and put it in him.
You mean to say printed in the sense the impression?
Oh, it's a metal printer.
It's a
metal printer.
Okay.
Yeah. So according to size of the patient, we have printed this implant. First, get an X-ray done, CT scan done.
Case of 3D printed talus. Show.
So this is the 3D printed model.
Got it.
Of plastic, and this was the tumor here. So we need to remove this bone here. This bone was removed, and this is the implant. You can appreciate here. This is the 3D printed implant. So very few centers across the world are doing this surgery. So it's very rare type of surgery.
Creditable, really creditable.
And the advantage is it's free for the patient. The implants are costing 3 to 4 lakhs, but government is significantly helping. So that's the thing. And this is the recent thing what we are trying, virtual reality. So again, this is the new thing. And lastly, what we want to show is never give up and be strong and positive. The patient doesn't have a limb, upper limb or lower limb, it doesn't affect. they can go back to their all activities. And
Definitely.
this was the patent thing what we got. So
Yes.
these are the two engineers which helped us.
I
And this
see.
is the biopsy gun.
People who do not know what whom to approach for this kind of discomfort, and it is mostly I feel in rural areas is what I see, wherein I have seen children with lot of discomfort just on the road, playing on the road, but it is normal life for them because they don't know where to go for the treatment. How are we educating such
So we are trying to have few conferences, medical conferences, which are for orthopedic surgeons and oncosurgeons. So that we are doing. Try to educate the orthopedic surgeon that if he sees anything like this, he should refer to this patient to a hospital, a tertiary cancer center. So ours is a tertiary cancer center. So across the country, there are every state is having a cancer center. So Bangalore is having one, Kidwai, Chennai, there is ADR, in Mumbai it's Tata Cancer Hospital, Delhi it's AIMS. So every state is having one cancer center, big cancer center. It's a tertiary cancer center. So better that patient goes to this type of hospital where the treatment is nearly free or very subsidized, and they can take help of these type of methods
So
because the
all the government
future
centers
also
have this
transportation is also free.
right. All the government centers
Yeah,
have
nearly all centers do all these type of things.
yes. Okay.
Nearly centers have. Nearly all centers have.
Wonderful. Great. Thank you so much for sharing so much of information. It is really surprise element for me as well. So that's a great talking to you. Thank you so much.
Thanks. Bye.
Thank you. Namaste.